Some of the most damaging infections in medicine are not the ones that scream for attention. They are the ones that stay quiet. No pain, no fever, no obvious warning, just silence, while damage slowly unfolds. Imagine this scenario. A young adult feels completely healthy. Life is normal. Work, relationships, plans for the future. Nothing seems wrong. But inside the body, an infection has already taken hold. It spreads quietly through delicate tissues, leaving microscopic scars that may not reveal themselves until years later. And by the time symptoms appear, the consequences may already be permanent. What makes this situation unsettling is that the person never felt sick in the first place. This hidden infection has a name. It's called chlamydia, and it is one of the most common sexually transmitted infections in the world. But its real danger is not how severe it feels. Its danger is how often it doesn't feel like anything at all. Let's look at how this infection spreads. Chlamydia is caused by a bacterium called Chlamydia. It spreads through sexual contact, vaginal, anal, or oral. When infected, bodily fluids come into contact with the mucosal surfaces of another person. Once inside the body, the bacteria infect cells lining the reproductive tract. But instead of triggering immediate dramatic illness, the infection often stays subtle or completely silent. In fact, most people with chlamydia don't know they have it. Studies consistently show that a large percentage of infected individuals, especially women, have no noticeable symptoms. That creates a dangerous illusion. If someone feels healthy, they assume nothing is wrong. But clinical reality is very different from expectation. Most people imagine that sexually transmitted infections cause obvious signs. They expect burning pain, discharge, visible sores. Sometimes those symptoms happen, but with chlamydia, the infection often behaves like a quiet tenant, occupying a room in the body without making noise. And while it stays quiet, it can still spread to others and slowly affect reproductive organs. Men and women often experience this infection differently. In men, when symptoms do occur, they may include burning during urination or discharge from the penis. Some men develop inflammation of the epididymis, causing testicular discomfort, but many men still experience very mild or no symptoms at all. Women face a different and often more serious risk. Chlamydia commonly infects the cervix, but the bacteria can move upward into the uterus and fallopian tubes. When that happens, it can lead to a condition called pelvic inflammatory disease, often abbreviated as PID. This is where the quiet infection becomes dangerous. Inflammation inside the fallopian tubes can create scar tissue. Those scars may interfere with the normal movement of eggs from the ovaries toward the uterus, and this is where long-term complications begin to appear. Some women develop chronic pelvic pain that persists long after the infection is gone. Others face difficulty becoming pregnant. In severe cases, the scarring increases the risk of ectopic pregnancy, a life-threatening situation where a pregnancy develops outside the uterus. What makes these complications tragic is that they can occur even in people who never knew they had the infection. No warning, no dramatic illness, just silent damage. This is why relying on symptoms alone is a dangerous strategy. Feeling healthy does not guarantee that the reproductive system is free from infection. That is exactly why modern public health guidelines emphasize routine screening, especially for sexually active young adults and individuals with new or multiple partners. Testing allows clinicians to detect infections before complications develop, because once identified, chlamydia is usually treatable with antibiotics. But treatment only works when the infection is actually detected, and silent infections rarely reveal themselves without testing. There is an interesting paradox here. The most noticeable infections often push people to seek medical help quickly, but the quiet infections, the ones that barely disturb daily life, are the ones most likely to remain untreated. Chlamydia sits squarely in that category, common, often invisible, yet capable of long-term consequences. So how do clinicians confirm whether someone actually has this infection? Symptoms alone are unreliable. Physical exams are often normal. Instead, doctors rely on sensitive laboratory tests that detect the genetic material of the bacteria itself. But understanding how those tests work opens another fascinating chapter in modern diagnostics. And that's exactly what we'll explore next. Because detecting a silent infection requires technology designed to find what the body itself might not reveal.